So as a physical therapist, occupational therapist, speech language pathologist, there are three types of therapy that you provide. By far, the most common type of therapy you provide is called rehabilitative therapy. And what rehabilitative therapy is a patient did acquire the skill. They did learn how to do something. So for example, they learned how to speak, think, reason, eat, drink, chew. They learned how to bathe, dress, do simple meal prep, household chores. They learned how to, get out of bed, stand up, walk, do stairs. Something has now happened to them. They've had an injury, an illness, maybe an exacerbation of a chronic condition. Either they cannot do those things I just said, or they have difficulty doing those things. They have limitations doing those things, and we're trying to get them back to where they were before. That is called rehabilitative therapy. If you're a therapist that treats pediatrics, you probably hear the term called habilitative therapy, because unfortunately that child you are treating never acquired the skill. They never learned. You're trying to get them to acquire the skill for their very first time. That's why it is called habilitative therapy. So think of these kids, born with CP, Down syndrome, muscular dystrophy, infantile CVA, developmental delay. That would be habilitative therapy. The third type of therapy, which is the least common that we do, is called maintenance therapy. And the goal of maintenance therapy is either to maintain a patient's current level of function or prevent further decline in their function. So an example could be a patient with Parkinson's, or maybe Lou Gehrig's disease, ALS. As the ALS continues to progress, might the patient come back periodically for outpatient therapy services, for you to do an eval or re-eval, reassess the patient. Based on those findings, update the home exercise program. As things continue to deteriorate, might caregiver training, caregiver education come into play, where you're teaching the caregiver how to do stretching, range of motion, transfers, how to assist the patient with bathing, dressing, going up and down steps. Again, as it continues to progress, unfortunately, are you now assessing for equipment needs at home, like a wheelchair, bedside commode, hospital bed? Are we going from a regular diet to some kind of puree diet, which should maybe a peg tube? That is maintenance therapy. Now, original Medicare does reimburse for maintenance therapy. Because original Medicare covers maintenance therapy, Medicare Advantage plans must also cover maintenance therapy. However, most other federal payers and commercial insurers do not knowingly reimburse for maintenance therapy. The key is whether you're doing rehabilitative, habilitative, or maintenance must require the unique skills of a therapist to provide, or for an assistant to provide under the direction and supervision of a therapist. So once you say as a therapist, they no longer need me. They don't need my hands, my decision making. They can do this at home by themselves as a home exercise program. They can do this at home with the assistance of a caregiver. They can go to a local fitness gym, do it there. What you're really saying is they no longer need services that would be considered covered therapy services by the insurance company, and you should discharge them from therapy.